An FDA advisory panel has recommended approval of Pfizer COVID vaccine shots for children ages 5 to 11.
Now, this recommendation, if adopted by the FDA and the CDC, would make some 28 million kids eligible for the vaccine. Dr. Frank McGeorge with a closer look at today's vote. Frank?
We expected a vigorous debate because the risk-benefit equation is different when you're talking about children. Now, we've actually also learned some members of the committee were the focus of a coordinated email attack over the weekend by parents opposing the vaccine. The FDA's Dr. Peter Marks actually started the meeting by saying there are passionate feelings about this vaccine on both sides.
I want to acknowledge the fact that there are strong feelings that have clearly been expressed by members of the public, both for and against the use of the Pfizer-BioNTech vaccine under emergency use authorization for this age group.
At the center of the debate, how to balance the benefits against the risks. While the risk from COVID is much lower for children, cases are climbing and there have been hospitalizations and deaths.
Between January 1st, 2020 and October 16th, 2021, there were 94 COVID-19 associated deaths reported among children 5 to 11 years of age.
More than 5,200 children have also been diagnosed with MIS-C, a serious multi-system inflammatory syndrome. But the panel of outside experts was concerned about the risk of myocarditis, especially in males.
This is the principal concern that people have regarding use of these mRNA vaccines in children.
The CDC presented several models that showed the benefits of the vaccine outweighed the risk of myocarditis, except when COVID cases fell very low. Some panelists argued in support of the vaccine.
To me, the question is pretty clear. We don't want children to be dying of COVID, even if it is far fewer children than adults, and we don't want them in the ICU.
Others voiced the fear of some parents when it comes to choice.
I'm just worried that if we say yes, that the states are going to mandate administration of this vaccine to children in order to go to school, and I do not agree with that.
Now, the root of the problem is we will never know the true risk of rare side effects in this group unless the vaccine is made widely available, and the panel had to weigh that versus the known risks of COVID to this age group. Back to you.
Dr. McGeorge, thank you. Governor Gretchen Whitmer, though, says her administration has pre-ordered 287,000 doses of the Pfizer vaccine in anticipation of final approval.
Governor calling it a game changer to ensure in-person learning will continue.
What we want to do is make sure that parents know this vaccine is available for their kids so that they can go out and get their kids inoculated. We do it for a variety of illnesses. This has high efficacy. It is incredibly easy to get, and soon for 5 to 11-year-olds, that will be the case. And so we want to encourage parents to get their kids vaccinated.
And where do we stand tonight? Right now, 66.9% of Michiganders, just a hair under 67%. Michiganders 12 years and older have received at least one dose of the vaccine.